As expected, after we did a story last week or the week before it was, about the new outbreak of measles in New York City and the direct connection to those choosing not to vaccinate their children, we took some heat as usual. We get a lot of criticism when that's a subject we touch, not because I think a large percentage of our core audience really feels strongly about the issue, but I think it's because when we talk about it, people who care specifically about that issue come in and criticize us. We now have another story which has been sent to me 10, 15, 20 times related to vaccines, and it's being sent to me by anti-vaccine advocates. And the story is from Digital Journal, and it outlines how Ohio State students are now having an outbreak of mumps, and that all but one of these students have been vaccinated. And then the question is, David, you are for vaccines, and by for vaccines, I don't believe that vaccines cause autism or the diseases they are meant to prevent and are generally safe and effective. That's me being for vaccines. I'm asked to explain the situation. So I looked at the article and I went into it with an open mind, and it says, a city health department spokesman says that the mumps cases at Ohio State University have now reached 28. Rodriguez, the spokesman, says that all but one of those infected received at least one dose of the mumps vaccine, that this includes 23 students and a staff member, and then others connected to either students or the Ohio State University community. And it also adds that a CDC expert on mumps and other diseases says that people who are vaccinated may still get the mumps. So you look at it, a quick scan, you say, David, they all were vaccinated and the vaccine doesn't prevent infection. We've got it all right there. Well, I decided to look into it a little bit further. And by a little bit further, I mean just the most tangential internet research which any of us could do. At least one dose of the mumps vaccine. Well, what is a proper dose of the mumps vaccine? And if you look on the Centers for Disease Control, they state very clearly, if you are in a situation like being in a post-secondary education facility, which Ohio State University is, we're talking about college and university classrooms and dorms, you should have a second dose within 28 days of the first dose. So to be properly protected, for the vaccine to be effective as designed, you should have one dose and then a subsequent dose within 28 days. The article doesn't tell us that even one person who has been infected with mumps had the proper dose, which includes a booster after 28 days. So right away, Lewis, we know nothing about whether these individuals were vaccinated by the letter of what it means to be vaccinated. We have no information. All we know is they had at least one dose. And as we know, one dose is not the proper dosage.
That's true. We also know that diseases, these illnesses can mutate, I guess is the word, that there are different strains that they can the vaccination might not properly work against a different strain. I don't know if that's happening, but I'm just speculating.
It's part of the 80 to 90% effectiveness. With a proper dose, you have 80 to 90% protection. And what this means is that if the strains start to change, and we're not saying that strain theory, not string theory, strain theory is applicable specifically to mumps, but generally speaking, different strains will obviously not be as, the vaccine will not be effective as blocking mutated strains. And if you are infected, even when you have the vaccine, your case will typically be much less harsh, much less severe. The last thing about this, imagine if I were to say to you, ibuprofen doesn't prevent headaches. I took a milligram of ibuprofen, my headache didn't go away. And then you say, oh, that's interesting, ibuprofen must not work. Then you research and it turns out, well, a proper dose for ibuprofen is 200 to 400 milligrams, not to exceed 800 in a 24-hour period. All of a sudden we say, well, of what value is it to say that someone who didn't take the right dose didn't have symptom relief? That's what we're talking about in this article. This article by no means tells us anything valuable about the effectiveness of these vaccines.